Greetings, all. So, we're going to do a quick lecture on public health threats and how they are often misrepresented in the media. This is a cartoon I found online. You've probably seen this before. Um, this came about last year. Everybody was so overly concerned with the Ebola uh, epidemic, which never really hit the United States. I think there were two or three people that actually died from Ebola. Um, they were all healthcare workers that were actually working in Africa and then came back. But the Ebola was never a realistic threat in the United States for the rest of us. Meanwhile, 300,000 people a year dying from obesity, almost 500,000 people from tobacco, and alcohol kills almost 100,000 people a year. And, we see the commercials for fast food. We don't really see commercials for tobacco anymore, but you certainly see a lot of alcohol commercials. And meanwhile, the media was, playing up the risk of Ebola. So the latest epidemic that everybody's concerned about is the measles. 2014 was the highest rate in the United States in probably a decade anyway of measles. About 650 people were infected with the measles. At least that's what they know. That's what the CDC knows of. There's probably a little bit more than that. Again, it was the highest rate of measles in the U.S. in the past few decades. Of those 650 people, over half were over the age of 20. 15% required hospitalization. All right, so what's that, about 75 maybe? 80 people that ended up in the hospital because of measles, and nobody died. For the most part, measles is a virus. You're sick for 7 to 10 days, you get a rash, and then it goes away, and then most people never get it again. So it's not really a big threat. It can be a threat in other countries, especially where poverty is endemic. That's really where we see the big problems with measles mortality, is when vaccination rates are lower than 80%, and especially when it's lower vaccination rates in a country that has very high poverty rates. That's really where we see measles mortality issues. Back in before we introduced the measles vaccination in the United States, they were about 500 deaths a year from the measles. But again, a lot of those were related more to poverty than anything else, and just a lack of, we have a lot more advanced care. We're talking about almost 60 years ago. All right, so most of those 650 cases, were associated with importations from other countries. So people were coming in from the Philippines primarily, I think it was in 2014, um, and then getting people infected here with the measles. Almost everybody that was infected was unvaccinated. Um, about 10% of the population is unvaccinated. So as far as an incidence rate, we love to use these in epidemiology. We're talking about 2 per 100,000 of unvaccinated people. So for every 100,000 unvaccinated people, 2 of those people were infected with the measles. And as far as the total population, we're talking about 2 in a million. So it's not a 1 in a million chance, it's a 2 in a million chance that somebody is going to get the measles. And this was in the biggest measles epidemic that we've seen in decades. Hospitalization rates for the general population, 3 in a million. I'm sorry, 3 in a million of unvaccinated people, and 3 per 10 million in vaccinated. So for every 10 million people that were vaccinated, 3 actually ended up in the hospital. Case fatality rate was 0, so nobody died. There were no measles deaths. In fact, there hasn't been a death from measles in the United States, I think, in about a decade or so. Meanwhile, let's compare this to asthma. Asthma is a chronic condition. About 25 million Americans suffer from asthma. Rates of asthma are also at an all-time high. It's considered epidemic. Since 1980, asthma death rates have increased more than 50%. Mortality rate for children has increased more than 80% in that time period. There are 1.75 million emergency room visits related to asthma. Almost half of those are children. It's the number one cause of school absenteeism resulting from a chronic condition. Every day, 9 people die from asthma. 9 Americans die from asthma. This number here of 3,300 deaths every year, that's actually might be low. That was a number that I got from, I have the website there. I have another source that says 5,000 deaths a year. Mortality rate is about 1 per 100,000 Americans. African Americans are 3 times more likely to be hospitalized and 3 times more likely to die from asthma. Not has nothing to do with genetics, but completely due to health disparities, socioeconomics. Um, so again, this is our holistic circle for this course. We talk about nutrition, physical activity, stress management, environment. These are the things that we need to consider when we're looking at an epidemic like this. Obviously, environment is going to play a part. We know that air pollution can elevate risk for asthma. Stress can actually elevate or at least exacerbate asthma and allergies. Physical activity, there's something called exercise-induced asthma. I know, several people on my rugby team suffer from asthma, and they need to stop occasionally and take a puff off of their asthma medication. But what we're primarily concerned about here is nutrition. The primary ideology or underlying root cause of the asthma epidemic is nutrition, is diet, and we're going to take a look at this. So they did a huge study. It was over 1 million kids in 100 different countries to look at potential underlying causes of asthma, allergies, and eczema. So I should explain asthma and allergies. Not everybody that has allergies has asthma, but almost everybody that has asthma has allergies. So they're very closely related. So we usually kind of consider the two to be in the same category, at least, pretty much the same. So there were significant variations of the rates of the illness across the different countries. Certainly, air pollution, as I mentioned, plays a role. Smoking rates played a role. Secondhand smoke, especially when we're talking about kids. But diet was the most significant predictor of disease. There's a decrease in prevalence of illness with an increased consumption of whole plant food. So an increase in asthma prevalence with a decreased consumption of fresh fruits, green vegetables, and other sources of dietary antioxidants. Okay, so antioxidants are extremely important. Getting them from a pill form, from a vitamin form, probably doesn't do a whole lot for us. I mean, it might help a little bit, but for the most part, what we want to do is get these nutrients from whole plant sources. High intakes of high fat, um, sodium, low fiber, and carbohydrate. And I'm not talking about refined carbohydrate, but healthy carbohydrate, plant food. They're linked with bronchial reactivity and asthma, while traditional and vegetarian diets are associated with lower rates of asthma. So, in other words, the standard American diet: high fat, high sodium, junk food, low plant food. Fiber comes from whole plant food. So, low in fiber, low in healthy carbohydrate. That is primarily what is associated with asthma. Eggs have been implicated, dairy products have been implicated, soda, fast food, all these things have been implicated in elevating risk for asthma. Whole soy products like tofu and edamame, they seem to lower risk, as well as whole fruit products. Again, not fruit juice, but whole fruit. There was a study done where they took a group of kids that had asthma and they removed eggs and dairy from their diet, and they had significant improvement in asthmatic function, in lung function. Um, High vegetable intake, again, we've seen that high vegetable intake, high fruit intake seems to be protective, seems to protect kids against asthma. Fast food actually increases risk. Um, Risks of bronchial hyperreactivity are increased sevenfold among those with the lowest intake of vitamin C. Again, vitamin C from plant forms. While the lowest intake of saturated fats results in a tenfold protection. Saturated fats primarily come from animal products. So overall, more toxic environment combined with a more susceptible population resulting from poor diet is the primary ideology of the asthma epidemic. The CDC, the Center for Disease Control, identifies low fruit and vegetable intake as a primary cause of morbidity and mortality in the United States. They estimate that 75% of Americans are not meeting the 5 servings a day recommendation. That 5 servings a day recommendation is probably about half of what we should really be getting. It's probably more like 9 to 13. That's what a lot of nutrition groups say, and about 95% of Americans are not meeting that goal. Okay, some other contributors. There's a chemical called BPA, bisphenol A. It's they know that this or they're it's they've done a ton of studies that show that BPA elevates risk for asthma. They actually measured the concentration of BPA in the urine of children that had asthma, and they found that they had relatively high concentrations of BPA in their urine. Uh, there was a report, we'll cover this later in the semester. It's called the President's Report on Cancer. The Department of Health and Human Services put together a report. They sent it to President Obama in 2010. All the variety of concerns about environmental toxicity. Number one at the top of their list was BPA. They urged the president to ban the use of the chemical, which still has not happened. Several studies indicate that exposure to antibiotics in the first 2 to 3 years of life increases risk of asthma. So we've known, again, for a while that the healthcare community has been overly relying on antibiotics. They oftentimes will prescribe antibiotics for viral infections. Antibiotics do nothing for viral infections. They're great for bacterial infections, but they don't do anything for viral infections. And a lot of times a doctor will just give it as a placebo, more or less. A parent comes in with a sick child. They want something, they want a prescription. They want the doctor to do something, so they write them a prescription for an antibiotic. And overexposure to these drugs, these are very important drugs, and overexposure to these drugs is causing a lot of problems. Some other things that I do not have up here, C-sections, being born, sometimes C-sections are absolutely necessary, but a lot of times people opt to have C-sections because they don't want to go through a delivery. And we do know that C-sections elevate risk for asthma. And breastfeeding. Breastfeeding will decrease risk of asthma. Bottle feeding with a formula will increase risk of asthma. So all these things, antibiotic usage, breastfeeding, C-sections, these might increase risk for asthma. But on top of that, even if someone has asthma, they can, for the most part, control it. Most people can control it with a healthy diet, with eating a healthy dose of fruits and vegetables, and minimizing or eliminating animal product from the diet. Something else I came across, and this came from Cornell, so feel free to check this out on your own. Cornell and Stanford both did studies, what we call meta-analysis. What they found was that about 80% of the asthma deaths are caused by the drugs that are used for asthma. Advair, Ceravent, there's a couple more, Formidil. I've heard of Advair, but not the other ones. Basically what they found was that they did a huge, what we call meta-analysis. Sometimes it's called a systematic review, which is very similar, but a little bit different. They looked at all the clinical trials that were published, over 30,000 patients, and what they found was that the people that were on the drug were more likely to die than people that were just taking a placebo. So this is pretty concerning. This is a health condition that is preventable. It's treatable with diet, with nutrition, for the most part. And instead, doctors are prescribing this drug, which is more likely to kill the patient. So this is, the main cause. So 80% of asthma deaths are caused by these drugs. So this is the number. I don't know if I have it here, but this is what they say, 5,000. So they say 5,000 deaths a year. So whatever 80% of 5,000 is, I should know this off the top of my head. Whatever 80% of 5,000 is, that's how many people are dying from these drugs every year. And it's completely unnecessary. Other than this, these are the main causes of the asthma epidemic and the asthma mortality. Dairy products, soda, fast food, processed food especially processed food that contains BPA, bisphenol A. And when you see, these health reports in the media, and they talk about, the dangers of measles epidemics, and I certainly don't want to downplay the importance of measles epidemic. This is not an anti-vaccine message. Okay, I fully support the CDC's recommendations for measles vaccination and all the other vaccinations. What this lecture is about is the way that the public health risks are completely misrepresented. And, how likely is it that when you're watching the evening news that they're going to talk about, the true underlying cause of the asthma epidemic, and then cut to commercial for McDonald's or Hot Pockets or Cheetos, or whatever it is, or a drug commercial. And this is why these, unfortunately, the health messages get skewed within the public, within the mass media. Okay? Hope this was helpful. Take care.